Hi, everyone. Thanks again for joining today. This is our Healthcare-Associated Infections and Antimicrobial Resistance webinar. My name is Hannah. I'm usually the one who sends you all the reminder emails and the invites. I did want to give just a little bit of an update before I hand it over to our presenters today. One thing that our team is doing, we're starting to look a little bit into CRE versus CP-CRE screens. So if your facility, yourself, anyone has any questions surrounding those, feel free to send your questions to myself or anyone on our team. And we're going to try and gather some information and give an update at our next webinar. Our next webinar is scheduled for June. It'll be the last Tuesday in June, so June 28th at 2 p.m. It should be on the same invite, but again, I'll send you some reminder emails as well. But with that, I'll go ahead and turn it over to our presenters today. Today we have our Project Firstline team presenting. So we have Danielle and Allie, and I'll let you guys take it over.
Hello, everyone. I'm going to share my screen real fast. Slide deck for you today. Can you guys see that?
Yes.
Awesome. Hello, everyone. My name is Allie Nelson. I am a health educator here at the Indiana Department of Health, working on Indiana's Project Firstline initiative, and Danielle is here today also. She is the other health educator with us at the state, and she will be sharing here in a second. But I'll go ahead and get us started. So today we just wanted to talk to you guys about what is Project Firstline, and how is Indiana using Project Firstline across the state. So this is a collaboration between CDC Project Firstline and the Indiana Department of Health. So if you haven't heard of Project Firstline, Project Firstline's goal is to make sure that you or any healthcare worker has the infection control knowledge that you need and deserve to keep yourself, your patients, your colleagues, and your family safe. Project Firstline is CDC's new national training collaborative for infection control. It's a comprehensive infection control program designed to prevent the spread of infectious diseases in U.S. healthcare settings. So Project Firstline has a lot of different facilitator toolkits and infection prevention and control trainings for healthcare facilities, for healthcare workers to take into their facilities and to train those that the trainings are for anybody that works in a healthcare facility. So whether it's nurses, doctors, EBS workers, receptionists, anyone that resides in a healthcare facility. So, and Project Firstline emphasizes the why behind infection control actions, so that no matter anyone's varied experiences, backgrounds, or work environments, participants will have the skills and knowledge to make informed decisions to keep themselves and their coworkers and their patients safe. So again, Project Firstline is about empowering individuals through training and practical tools, really immersing individuals into the infection control training area, and then helping to produce lasting results through providing adequate infection control training. So currently, Project Firstline has a lot of trainings available. All of the trainings that Project Firstline produces are available on their website. If you could just Google CDC Project Firstline. Their first round of trainings, which are the ones that are not italicized or bolded, are the ones, these are all in 10-minute, 20-minute, or hour formats. So these trainings look like they come with a facilitator toolkit. So you have a slide deck with scripts in the notes sections telling you or providing you an example of how to present. They also have videos embedded in them of Dr. Abby from CDC presenting on the topic. And again, these are created so that anyone can pull these trainings, and depending on how much time they have available to train, they can adapt to their situation to provide these trainings. So obviously, these first rounds of trainings were very specific towards the COVID-19 pandemic. So you'll see a lot of those trainings are about how COVID-19 spreads, virus strains, different things like that. So They are COVID focused, but they are still beneficial even for other infectious diseases as well. And CDC did just a couple of weeks ago, or about a month ago, released their new year of training opportunity. So they're now transitioning the focus onto how to recognize the risk of infectious diseases in healthcare facilities and understanding what reservoirs are. And if we can recognize the risk, that we are able to take actions to prevent the spread of infectious disease. So they have released 6 trainings currently over how to recognize the risk, how germs make people sick, how to recognize reservoirs, and different types of reservoirs. So again, those are also available on the CDC website. And they, in addition to these trainings, there are job aids available for printing to post, different videos, short clips, interactive modules, or activities that you all can have within your toolkit. So yeah, so now Danielle's going to transition. We're going to talk about how we have used what CDC Project Firstline has produced in Indiana. So years 1 and 2 account for from 2020 to 2022 what we've been working on.
Thank you, Ellie. Yes, my name is Danielle Goff. I'm the other health educator here for Project Firstline and IDOH. So what I'm going to do over the next several slides is kind of go over what we've been doing in the past year 1 and year 2. We've been busy disseminating Project Firstline's information throughout Indiana. So this slide is just a brief bullet pointed things that we've done, and I'll do more of a deep dive in the upcoming slides. But we started year 1 with conducting surveys and town halls to identify IPC knowledge gaps throughout Indiana, and that was for all healthcare workers. Based on our results, we were able to create IPC training modules based on those needs from those surveys and town halls. We have, and we're still in the process of doing regional trainings by infection preventionists throughout the state, and these are IPC Project Firstline trainings. So that's been we've been successful with that. Also, we've had the chance to and the opportunity to partner with APIC Indiana, their fall and spring conferences. So we have we were able to present and have our own infection preventionist team really go and present Project Firstline trainings. And then we are in the process of, and we're coming up next week. I can't believe it's coming up. There's going to be a large 2-day event based on Project Firstline trainings. It's kind of the culmination of year 1 and 2 and everything that we have done. And I'll go a bit more into that soon. And we're also in the process still of hosting a really successful ECHO training for local health departments around the state. We are in the process also of starting in the near future at ECHO for EMS professionals. Next slide, Ellie. All right, partnership brings great impact. I like this slide because we could not have done any of this without our partners. Next slide. So just a huge shout out to our partners right here. Obviously, CDC, this is definitely their initiative, and we've been very pleased with the information that they're rolling out and they continue to roll out. We've partnered with University of Indianapolis Center for Aging and Community when it comes to when we did our town halls and surveys to figure out the gaps of knowledge throughout the state. They've been a huge help with the town halls and surveys, as well as creating educational modules, which will be released hopefully in the near future. We're still working on it. And I apologize, there's some banging at my house today. We're having some construction done, so sorry about that. So we're working on educational modules, and they're going to be coming out, and there will be a quiz at the end, and it's going to be available for all healthcare workers and paraprofessionals throughout the state. So when that's released, I'm sure everybody will get information. APIC Indiana, we partner with them, IUPUI, the Richard Fairbanks School of Public Health, and Project ECHO. And next slide, please. So I know I kind of already just jumped into I started going over this in the last slide, but with University of Indianapolis, we have they helped us conduct early 2021, March and April, town halls and survey, 4 live town halls, and then a learning needs assessment was sent out through all different mailing lists. And we were able to really find out and get a gauge of what healthcare professionals knew and what they wanted to know. And it was really great feedback that we got. And based on that, we are in the process of still creating these modules. We have 5 on the way, and they are going to go over just, what is science and all the, PPE and just really based on what the results that we got from those town halls and surveys. We're going to have interactive modules, and it's a really cool, like 3 to 5 minute animation followed by a quiz. So that will be released, we're hoping sometime later this year. Next slide. Oh, and Project Firstline training. So again, APIC Indiana, we've been really happy with working with them, and we have been able to disseminate Project Firstline trainings throughout the state with their regional leaders. So right now, I think we're almost done. We have a few more in the works, and they consisted of about 3 hours of IPC Project Firstline trainings. So we've been happy with that. We've also had the chance to work with our own team, IDOH infection preventionist team, to go over Project Firstline trainings at the APIC Indiana's Fall and Spring Conference. So the spring one we just completed, it was towards the end of March, and that was a really great day. So we're very pleased with that. Next slide. And Project Echo. So this has been a really cool opportunity that we've done. We've partnered with IUPUI's Fairbanks School of Public Health to disseminate Project Firstline's trainings to all local health departments. And these trainings are happening every week at 9:30 on Wednesdays. So we're in the middle of it. We're almost a little over halfway through all of the trainings, but it's been a really cool way for local health departments to learn about Project Firstline and also talk amongst themselves and talk about how they best practices and what they can learn from each other. So Project Echo, for those of you that don't know what it is, it's kind of like a Zoom platform, and there's and it's followed with a training, which has consisted of Project Firstline mainly, followed by community stories. So local health departments have been offering up and volunteering to go over their own information and community stories that have something to do with what that topic of the week. So it's been a really great way to work with each other's peers, and really have a great collaboration with each other. And we are also in the process of starting another Project Echo series sometime, hopefully this summer, with EMS workers. So right now it's local health departments, and the next round will be with EMS workers throughout the state of Indiana. Next slide. And this is awesome. If you guys might have already seen this come through in your email, but Project Firstline in Indiana, this is the culmination of the past 2 years. It's a big 2-day event in Indianapolis. It's a free event. We encourage anyone that can make it for one of the days, because they're both identical days. So register for either the 3rd or the 4th. So it's next Tuesday and Wednesday. And it will be at the Biltwell downtown. It's a really neat venue. I'm very excited to see how it pans out. But we are going to have preventers, our own infection preventionists at IDOH, present with different Project Firstline topics. And we are also expecting to have Dr. Abby Carlson come from the CDC, hopefully, as long as the travel ban doesn't come back. So, but if she's not able to be there in person, although I believe she will be, if she's not, we're going to make sure that she's there live via Zoom. So please register if you're able to for one of the days. It's frontline.com, and have some good food, a really neat venue, and a day downtown. And it looks like the weather's going to be great. So it'll be really fun to hang out. Next slide.
Sorry, I didn't realize I was muted. So thanks, Danielle. Now I just want to take some time to share where we're going in the future with Project Firstline. So 2022 is the wrap up of our first round of funding for Project Firstline, and we're getting ready to move into years 2022 through 2024. So here are our plans for the next coming years with Project Firstline. I can get my slides. All right, so here is just, again, bullet points of what we plan to do with Project Firstline. One of our initiatives is to continue partnering with local health departments to engage and train frontline healthcare workers, being able to come alongside those local health departments and see where they're at and how we can help them initiate Project Firstline trainings within their community healthcare facilities. We also plan to integrate Project Firstline trainings into the training for CNAs, QMAs, or qualified medical assistants, community health workers, paramedics, surgical techs, etc. So to complete this, we will be partnering with Mickey AHEC, which stands for the Metropolitan Indianapolis Central Indiana Area Health Education Center. I'm very surprised that I remembered that whole acronym, but so we will be partnering with them to kind of be a pilot of how we can work with area health education centers who provide a lot of trainings for these paraprofessionals on how we can integrate Project Firstline into their trainings that they already complete. So we're very excited for that, to have Mickey AHEC kind of pilot that for year one, and then going into year two, Mickey AHEC will assist us in also working with other area health education centers across the state to continue to incorporate this training, Project Firstline training, into their curriculum. We're also partnering with the University of Indianapolis, and they're going to be working with different associations to help us integrate Project Firstline trainings into Indiana Schools of Nursing curriculum. So this is one initiative that CDC requested that we work on, is how to incorporate, these trainings just into current curriculum. So helping schools of nursing see how they can pull the Project Firstline modules that are already created and kind of maybe build those into their curriculum. We also plan to host monthly or quarterly calls for frontline workers and partners to discuss infection prevention and control topics, maybe what their needs are, what they're seeing in their facilities, where we could assist in providing trainings and things of that nature. And our last initiative is to launch an SMS messaging platform to reach frontline healthcare workers with Project Firstline trainings and local HAI threat information. So we're partnering with an organization called Probari to create a text messaging platform where people can subscribe to receive text messages from us. And we will be shooting out short snippets of Project Firstline training, as well as, again, more specific trainings related to local HAI threats that are in the area. So again, these are just our partners for the next 2 years. Again, we're partnering with the University of Indianapolis Center for Aging and Community to help us facilitate all of these activities. Again, CDC Project Firstline, who is providing all of this wonderful information for us. And then Probari, who again is working with us for the text messaging platform. And then Mickey AHEC, which is helping us integrate Project Firstline trainings into current curriculum. So we're very excited to continue some partnerships and create new partnerships with new organizations. And we're really looking forward to how Project Firstline can continue to spread and infiltrate, just different curriculums and trainings across the state. Last but not least, we know that infection control protects you, your coworkers, your patients, and your community. So we're really excited to see Project Firstline continue to, help to protect our healthcare workers and those who utilize healthcare facilities. So I think we have a little bit of time here. We would just love to open it up for some questions. I know that was kind of a quick presentation, but we went very briefly over what we've been working on. But if you have any questions for Danielle and I currently, or just offline, if you have any questions, you can reach us via our email addresses here on the slide. So thanks, guys, for allowing us to take some of your time to share about Project Firstline. I'm going to go ahead and stop sharing so I can see if there's anything in the chat, if there's any questions. So,
and Ellie, I was just thinking, would it be a good idea? Maybe I should show them that quick clip of infection risk for Project the New.
Yeah.
I'm going to share my screen for that real fast. This is a excuse me. This is a video that Project Firstline has come out. It's a good teaser for what's coming up for years 3 and 4. So give me 1 second and I'll bring that up for you. Can you see my screen okay?
Do not see it.
You don't? Okay, hold on a second. And stand by. How about now?
Yes.
Okay. All right. Can you hear it okay?
I do not hear it.
All right, stand by. What I'll try. I'm gonna stop sharing for a second and I'm gonna try to pull it up a different way and then we can answer questions in the meantime. I do apologize for all of the technical difficulty.
Yeah, Allie and Danielle, I'll just hop in real quick. This is Hannah. We can also post a link to that video as well afterwards. So if we
Okay.
can't figure it out, we'll be sure to post it as well.
Awesome. That would be great. I'm going to put in the chat right now just the link to the registration for our conference next week. Yeah, if anyone's interested in registering, we would love to have you.
Any questions at all? Again, these are just really great tools for all of you to use. All right, I'm gonna try, let's see here. I'm gonna try sharing one more time. And if this doesn't work, we'll just send the link. Thanks for your patience, everybody. We do appreciate it. You see it?
Yes.
Can you
Cannot hear it.
No, you can't hear?
Nope.
Okay. Well, then I'll share the link for everybody. We really encourage you guys to watch it. It's exciting. So every time someone sees it, there's always positive reaction, and it definitely gives you an idea of what we're going to have access to in the future. So I'm going to share it in the chat right now. Thanks for your patience.
Yeah, I guess if nobody has any questions for us currently, I don't know, Hannah, if you guys have other things you need to discuss on this call, but I think that's all that Danielle and I had planned for our time. So,
yep.
Yeah, well, thank you guys again for coming on and presenting. We usually try to hang out maybe another 5 minutes or so in case anyone has questions.
Sure.
Guys, feel free to post questions in the chat. Like always, we have recorded, so we'll post the recording on our website, and we'll also post the slides as well if you guys are able to share those.
yeah.
Okay, perfect. So we'll post those as well to the website. I see Haley just put that in the chat, so there's a quick link for you. But otherwise, we'll just kind of hang out for a few more minutes in case anyone has any questions.
Sounds good.
You see in the chat here that Carolyn commented, would it be wise to include infection prevention back in the curriculum of healthcare worker programs? I'm assuming that's what you're meaning by HCW programs. And I guess, Carolyn, I would just ask, are you referencing a specific healthcare worker? I think we're trying to, get at that goal through partnering with Makey AHEC. They're going to be looking at how they can incorporate Project Firstline into various different curriculums for different individuals that work in healthcare settings.
All right. Well, thanks everyone for your comments and for attending today. And I saw Carolyn had put in just another comment. I do think infection prevention education is always a great idea. If anyone has any additional questions or comments, feel free to reach out to Allie or Danielle. You can also reach out to anyone on our HAI AR team and we'll help get you in touch with Allie and Danielle if you don't happen to have their email address. But again, we just want to thank everyone for joining us today, and feel free to send any questions that you have. Thanks, everybody.